Well, South Africa has tonight recorded over 16,000 new COVID-19 cases, and Gauteng accounts for more than 11,000 of them. A further 25 people have died from COVID-19 related complications. The National Institute for Communicable Diseases has reported these numbers tonight. In fact, it released the full data a short time ago as the country continues to fight against this new Omicron variant. Let's talk about this. I'm joined by Professor Koleka Mlisana, co-chair of the Ministerial Advisory Committee on COVID-19. Prof, a very good evening to you. Grateful for your time tonight. So Gauteng still firmly in the lead, 11,000 of the 16,000 new cases. Is this going to go all the way to the situation we're seeing in Europe where they're recording infections in the tens of thousands?
Good evening, Tembelihle, and thank you for having me, and good evening to all the viewers. We definitely would not be able to answer that question. We don't know how far this is going to go. But I mean, as we can see, within days, we have seen this very steep increase. And now we know that actually Omicron definitely has got increased transmissibility. And that is why we're seeing so many infections. But as to how far that is going to go, it really is always very difficult to tell. But it obviously is a cause for concern, and that is why we keep just saying the same messages, that we really need to make sure that each and every individual, they adhere to the public health and social measures. But also, as we have been saying, is that with the high number of cases, the next step then, within a week or two, and we should be getting that, that data now, is what then happens to the severity of the disease. There has been, the most people who are in the forefront, they are actually claiming that we are seeing a sort of a milder form of diseases, but we do understand that it is still very early, days. We really just need to see what happens in a week or two time, because a lot of times what we have seen with COVID is that somebody would come in with mild symptoms in the beginning, and then as they progress, the disease might actually progress. We're hoping we're not going to get to that, especially backed up by the level of immunity that has occurred either by natural or vaccination immunity. So we need to all just tighten our belts and get ready. And more importantly, closely watching the numbers that are coming into the hospital, the spectrum of the disease, and ensuring that the hospitals are ready.
Mm-hmm. And in addressing the nation on Sunday, President Cyril Ramaphosa said we were to remain on alert level 1 of the lockdown because the situation wasn't at crisis point, right? Vaccines now readily available to most of us. As a Ministerial Advisory Committee, looking at where we are tonight with 16,000 new infections, 11,000 plus recorded yesterday, what advice are you giving to the government about what to do next?
Well, like I'm saying, right now, I think, COVID has taught us, and we do have enough, information to be able to tell what needs to be done when. And where we are right now in this fourth wave, with the past 3 waves and the many, people that have actually been exposed, we are therefore, we don't want to be, to go into a panic attack because of the numbers. But we continue to say, yes, we're seeing a number of cases, and we even understand that actually there's a significant number of people who are already vaccinated who are getting infected. But we believe because there's already an existing, immunity, the infections, therefore, are unlikely to be as severe. So right now, we are closely watching the cases that are getting into the hospital, because what is really going to force us to get into any, restrictions than where we are right now will be when we see that the healthcare system is going to be overburdened. And that's really when we will be able to say, well, right now, it looks like, we've got severe diseases, and that's when then we would need to make sure that we, the restrictions we get into, and ensuring that the healthcare facilities, there's supplies available in hospitals, there's, there's enough, human resources, as well as oxygen and ensuring that the supplies are constant and are there at all times. So for now, we are just saying, let's watch very closely. Let each and every individual make sure that they are vaccinated. I think right now, the main message really is to get as many South Africans vaccinated as we possibly can. And those, for instance, the healthcare workers need to make sure that they get their boosters. So that's where the message is at the moment. Avoid, crowded, areas as well. And we're saying no to any large gatherings. So that's the message at the moment. But as soon as we see increasing hospitalization, then we're going to have to change and see what other restrictions need to be entered into.
And Prof, what's peculiar, I suppose, about this wave is that we're seeing reports, in fact, this is reflected in the briefing today by the Health Department, of young children, 5 and younger, who are now coming down with COVID-19. It was very different with the previous waves that we experienced. How concerned should parents be?
No, everybody actually should be concerned, but what also is coming through as more information becomes available is that what hospitals are doing, they actually are testing all pediatric patients as they come into the wards. So we are now realizing that the numbers of, the increased number of cases of COVID may not necessarily have come into hospital because of COVID symptoms. But because the hospitals are testing everybody, then we are picking it up. And so it is obviously of concern, as I say, because even in pediatric patients, we don't expect to see severe disease in pediatric patients. So it just means the doctors, the healthcare workers need to pay close attention to those, and we see what happens. And there's been also anecdotal reports that are saying those children are coming in for different medical conditions, get diagnosed to have COVID, but they're in hospital for 2 or 3 days and they get discharged. So yes, it's a concern, but at the same time, we're not seeing any, severe infections.
So, Professor Mlisana, is it at this point too soon to attribute this apparent increase in children testing positive to the new variant, Omicron?
No, definitely. In fact, right now, we have got enough reason to believe that the majority, if not all, the majority of infections that we're seeing are due to Omicron. And the reason is because when we're looking at the genomic sequencing, Omicron, is sitting at more than 75%. So really, every isolate that is being sequenced, 75% and more are actually Omicron. So really, there's enough reason to believe that what is driving the infections right now, it is the new variant.
And as far as vaccinations are concerned, the issue is about young people in this country who are seemingly either not interested in vaccinating because they think being young buys them or stands them in better stead of fighting off an infection more successfully. Universities are now saying they want to implement mandatory vaccinations. The University of Johannesburg is the latest to do so, but it's being met with resistance. So how is the country going to overcome the issue of people resisting vaccination, especially the young?
Yeah. Temelihle, that's a necessary discussion, and everybody really needs to apply their minds, because where we're sitting right now, we know that public health and social interventions do work, and people need to stick to that. But more so, we know that vaccination does actually protect from severe disease, hospitalization, as well as death. That's proven, and everybody can see that, because people who are vaccinated, in fact, if we're looking at the spectrum of people who are getting into hospital, there's data that's coming out that's showing that those that are in hospital for COVID-related illnesses, the majority are actually not vaccinated. So it's important for people to realize the importance of vaccination. Now, there has been so many other ways of trying to actually encourage people to come for vaccination. But I think we really are getting to a place where we now need to say what then becomes good for the country, for the people, and not just look at individuals' wishes and what people would like to do or they would not like to do. And that's why the mandatory vaccination has got to come, because it's important, especially for specific, areas in the country. There's specific communities that really we need to say, otherwise if you are not vaccinated, you become a danger to the people that you serve. And so for me, I actually am saluting the tertiary institutions that are enforcing this, because it really is just the only way to go. Otherwise then, how are we going to live with COVID-19 if we don't ensure that we are highly vaccinated?
Other countries have already started to roll out booster vaccinations, a second or a third dose
right.
if you've got Pfizer and the other double dose vaccines. In South Africa, we're only doing additional vaccinations for people who are immunosuppressed, as well as healthcare workers who got the J&J jab at the beginning of the year. Why not start with boosters for the general population if you've got people who don't want to take them, and you've also got a segment of the population that says, give me as many shots as possible, whatever it takes to get the best protection?
Oh yeah, no, I support that. And really, I think what government needs to do now, really, we should have already started, offering boosters, especially to those that are, over 50, because there's obvious evidence that, the older you are with higher, with more morbidity, so you definitely need to, especially now, because we are already, into 6-8 months, that we started, rolling out vaccination. So I am sure and I'm confident that that is going to happen. It's just a matter of government planning how to implement that. But otherwise, it is the way to go, and there's already, preparations to get that going. So we really need to get people, booster doses. And as you say, if you've had Johnson & Johnson, you need, whether actually we call that a booster for Johnson & Johnson, or we just say it's a second dose for Johnson & Johnson. But that is important, and those that have actually received Pfizer. But I must just say, for Pfizer, I know that actually the Pfizer had already submitted an application to the regulator, and it's a matter of the regulator passing, that and approving that application, so that we can then get a third dose for Pfizer, for those that received Pfizer.
Professor Koleka Mlisana, co-chair of the Ministerial Advisory Committee on COVID-19. Good to speak to you tonight, ma'am. Thank you.